My name is Marco Strander, and I became affiliated with San Ysidro Health. The reason being is that I liked the mission of San Ysidro Health, especially access for all. Before I could walk, I wanted to be a firefighter. I blamed that on my mom. She showed me my first fire. I saw the guys fighting the fire, and I said, that's what I want to do. The last big fire was about 3 months before retiring. It was on the border, and it was what they called the cowboy fire. I was coming back into the station, I saw the smoke, and I reported it, and then we responded, and it was about 900 acres, which we were there for a few days. To travel out to our area, most people go Interstate 8 because that's how you get there. And they'll start climbing out of the city from El Cajon. They'll come up in the Alpine, start getting into the mountains, and they'll see, the mountainsides. When we had a good wet winter, everything's green, all the flowers are in bloom in spring. And in the winter, you got snow. Depending on their health needs, the access, the time, the convenience of it being closer. Before they drove 70 miles to get to health care. It's got a 53.7% poverty rate out there. So you have a mixture. The median age rate is 66.3. So you're looking at an older population. A lot of them are on Social Security, the seniors, and that's all they can afford to live out there. In the rural area, one of the biggies, and I'm going to say it over and over again, is the pharmacy's huge. That just saves a trip downtown for people to get their medications, especially when they find out they ran out. You're talking an hour plus drive. They get down there, they got to get their medication, and it may be an emergency type need too, where they have to take this medication. Having that pharmacy open is huge.
Hi, I'm Kevin Madsen, President and CEO of San Ysidro Health. Our mission is to improve the health and well-being of the communities we serve with access for all. I grew up in Nebraska, a small town in eastern Nebraska, and went to college in western Nebraska in a very small town, very rural town. So I have a lot of experience in rural communities. Each community has a different set of needs, and we want to make sure we're meeting the needs of the community and not just bringing a template boilerplate solution. When we started our telehealth program, the number of calls we got in the rural areas just confirmed the need for us to be there and helped us just establish those relationships that we hope to grow and develop additional trust in those communities. Our Mountain Health Community Center is a tremendous resource for people living in the Mountain Empire and backcountry. Again, access to food, access to health services is a challenge, and we do what we can to make sure the seniors in the Mountain Empire have access to foods, and we deliver. We had a successful event in 2022, and we're able to buy some new vehicles to help increase our delivery services to those residents in need. We look to the community to provide representation on the San Ysidro Health Board to make sure those communities have appropriate representation in the decision-making process for what we're doing there. San Ysidro Health has also been able to collaborate with other community health centers throughout San Diego County. The need is so great, it takes all of us to help meet the needs of the communities in San Diego. I'd also like to thank the Board of Directors for the trust they've given me and my executive team as we enter these new communities and provide healthcare services for those in need.
Mi nombre es Macario Gutiérrez y soy el presidente de la mesa directiva de San Ysidro Health. Siempre ha estado la mira del board y de los directivos es que se vaya a donde se necesita. Se me viene ahorita a la memoria, no sé, ustedes todos han visto el mural que está en San Isidro, ¿verdad? Y les explicaba, yo quiero que se vea algo donde se vea que hay unidad, que hay amor, que hay hay todo, y de ahí salió el corazón que se puso allí, ¿verdad? De esa idea, ¿verdad? De que todos nos viéramos servir a los enfermos con amor, con cariño.
Oftentimes we're in a position where we have patients come in that have no way of getting into town. It's a good 45 to 50 miles to the closest specialist. Oftentimes people can't afford the gas or they don't have a car to get down into town. And so we're working on providing transportation, working closely with patients. Small communities have big city problems, but they don't have access to care, and we have to be that link. We have to provide that.
I have gravitated towards working for a community health center to give back to the community because I understand the struggles and the inability to have these services to us or available to us. So we're very thankful for being invited to this community and to provide the much needed services.
Quiero darle en esta oportunidad, darle las gracias a todas los grupos, compañías, personas que con sus donativos, con su ayuda, han hecho crecer también a San Ysidro Health. Muchas gracias por toda esa ayuda. Esperamos que nos sigan ayudando como lo han hecho hasta ahora, y muchas gracias.